Thank you and welcome to the show this morning. The topic this morning is African Americans, kidney disease, and hypertension. And we're fortunate to have with us to talk about kidney disease, hypertension, and related diseases, Dr. MFaulkner. Dr. Faulkner is a professor in the Department of Internal Medicine at Meharry Medical College in Nashville, Tennessee. And of course, Dr. Faulkner, let me welcome you to the show this day.
Thank you very much.
And of course, Dr. Faulkner, I think we can only say that you've been with us a number of times, and each time that you've given us so much information and such quality information. And so what I'd like to do today is to give you an opportunity to allow our audience to see how you became Dr. MFaulkner at Meharry Medical College by perhaps tracing your background and some of the things that were important in terms of eventually leading you to Meharry and having the status that you have in dealing with the disease that you're dealing with. Let's do it from that perspective.
Well, it first started out when I was younger. I was in the hospital a lot. I had lots of operations. I had some orthopedic problems. And I thought this was a very interesting field to be in. And I went to college, Texas Southern University in Houston, Texas. And after I graduated from Texas Southern, I applied to Meharry Medical College and got in. And it started from that point. I did my residency at Meharry Medical College in internal medicine. And we seem to have a lot of kidney disease patients. Of course, you know, Hubbard Hospital, African American Hospital, will have lots of African American patients. And looked like every other patient had some type of kidney problem. I got very interested in it at that time. I did public health in Mississippi and then went to New York, Long Island Jewish, to do kidney diseases. And after that, I came back to Meharry Medical College. And I've been there ever since 1989.
And of course, you've been involved in a number of programs at Meharry Medical College. As a matter of fact, we've talked about some of these programs. Let's look at some of the things that you've been involved with at Meharry Medical College in terms of kidney disease and related areas.
Well, I first started out getting involved with grants dealing with organ donation, educational aspects around organ donation. And of course, I met Dr. Callender during that time, and for a few years I did lots of presentations on organ donation, organ donations, trying to encourage African Americans to donate, because as you know, many people on dialysis are African American. About a third of the list of people on dialysis are African Americans. And to get off of dialysis, someone has to give them a kidney. So I encouraged organ donation in the African American community as much as I could. Then I started looking at not only working on the back end, encouraging people to donate, but on the front end, trying to prevent kidney disease, or trying to decrease the progression of kidney disease. And of course, you know, I work with the African American study of hypertension and kidney disease, and that's an ongoing study still, 11 years at this point. So I've been working on both ends. Even now we're involved in a new study that's looking at lipids in kidney disease, the SHARP study, which has just come to our campus. So I've been working very hard on trying to prevent or decrease the progression of kidney disease, and also working hard on trying to get people off of dialysis, encouraging organ donation.
Now, you also indicated, I think, Dr. Faulkner, that there's a dialysis center at Meharry Medical College, and I think prior to this time it was a difficult problem in terms of having patients to go to different areas and et cetera instead of Meharry. I want to talk about that as soon as we come back for our second commercial break here. Let's start talking about that now, that dialysis center at Meharry. Okay,
that center at Meharry was in conjunction with Dialysis Clinic Incorporated and Meharry Medical College. Meharry donated the land, DCI built the unit. It serves the population in North Nashville. It's an open unit. Any patient that lives in that area that wants to go to that unit may go. It's a very nice unit. It has 26 stations. It built brand new. It's a marvelous staff that works there, marvelous patients that we have there. So it's a great place to be.
And of course, it's located, as you indicated, right in the center where there's a real problem in terms of some of the of kidney disease. Is that correct?
Yes, you know, kidney disease is very prevalent in the African American community. Of course, all over the world, about 5 million people have kidney disease. But the great number of percentages of people that are on, that have kidney failure is African American. We have a third of the patients on dialysis. There are about 260,000 patients on dialysis, and a third of those are African American. And we're only 12% of the United States population.
So it's a real problem and a real question dealing with this as a disease, kidney disease.
Yes.
Okay.
Yes.
Well, what we'll do after we come back from our first commercial break, we'll give you an opportunity to talk about that as a disease and the impact that it is having upon African Americans. And of course, we'll be back with our audience following this very, very short commercial break.
Be walking across Tennessee.